may have heard some unusual sounding terms being used lately. Vocal cord dysfunction, irritable larynx syndrome, paradoxical vocal fold motion. Might not mean anything to you unless you're one of the many sufferers of chronic tickle cough. It can be maddening. You've tried cough medicine, lozenges, meditation, a slew of doctors, and nothing seems to work. You might even have been told by one of those medical professionals, it's all in your head. That can be so frustrating. For some people, this problem can even feel like your throat is closing when you try to take a breath, or that you're choking. That's really frightening. But the situation is not hopeless, and it's definitely not in your head. Let's take a look at the causes of vocal cord dysfunction, and then we'll learn some simple techniques that you can use right away to get some relief. Hi, I'm Karen Sussman, the founder and director of the Professional Voice Care Center, talking about vocal cord dysfunction. I'm here to help you solve that chronic cough problem. Vocal cord dysfunction, or VCD, also called paradoxical vocal fold motion, or irritable larynx syndrome, or tickle cough, is when your vocal folds, your vocal cords, close when they're supposed to open. They would normally be opened when you take a breath. So now if they're closed, it can feel like you can't breathe. The vocal cords sit just above your trachea, your windpipe. So they're really a valve to your airway. If that valve shuts when you want to take a breath, that can be really frightening. Now, VCD is not life-threatening, but it sure can affect your quality of life. Some people with VCD may experience a chronic cough, shortness of breath, a feeling of throat tightness or spasm, even a choking or suffocating feeling, chronic throat clearing, a feeling of a lump in the throat, tension or pain in the throat when trying to breathe, or a wheezing sound when you try to breathe, even hoarseness or muscle tension dysphonia. If any of these sound like you, keep watching. Well, why do I even get these crazy symptoms? There are many possible causes which we plan to address elsewhere, so I'll just mention them briefly, including reflux, exercising, allergies, environmental irritants, chemical fumes, smoke, etc., postnasal drip or sinus infection, and last but definitely not least, stress or anxiety. Of course, it's important to learn to control or minimize these factors to reduce the root causes of your vocal cord dysfunction. And you should be evaluated by a pulmonologist, ENT, or allergist to rule out conditions that may cause similar symptoms, such as asthma. But if you've done all these things and you still have that annoying tickle cough or a feeling that your throat is closing, follow these simple steps to get those vocal cords to open up. I call this rescue breathing. And when you're having a coughing episode, we all want to be rescued. So here we go. It's helpful to sip room temperature water before and after every practice session. Sit tall, shoulders back and down, hand on your abdomen, and cue yourself to relax. Sip air in for 1 second through slightly tight lips, as if you're holding a small straw with your lips. Create a bit of resistance with your lips like this. Through those same little straw lips, blow air out in a fine stream for 3 seconds. Feel that slight resistance at your lips, like this. That fine stream of air will keep your vocal cords apart. Remember, when the air is flowing like this, you are breathing. You are not going to suffocate or die. You can control the opening of the vocal folds with this breathing exercise. Focus on the exhale, not on the panicky feeling you might get when you have trouble inhaling. If you can exhale, your next inhale will be automatic. So focus on what you can do. You can exhale. Focus your attention on your lips, not on your lungs. You can even focus on your abdominal area, expanding when you inhale and compressing on your exhale. All of these are safe areas to focus on because they are not the areas of tension or difficulty. Repeat the rescue breathing technique a total of 5 times in one practice session, like this. Sip your water. Last one. And sip water again when you finish your 5 reps. For those of you who prefer nasal breathing over mouth breathing, you can substitute a sniff in for 1 second instead of the sip in. Follow it once again with the fine stream of exhaled air out those little straw lips for 3 seconds, like this. And so on. Practice rescue breathing 5 reps 20 times a day when you're not having vocal cord dysfunction symptoms. Make this type of breathing automatic so that at the first sign of a cough, or even if you think you're going to cough, you can use rescue breathing to stop an episode of coughing or hopefully prevent one from starting. If you do experience a VCD episode, begin your rescue breathing immediately. You can begin with the sip or the sniff in or the fine stream exhale, but just start and don't stop until the urge to cough or the tight feeling in your throat goes away. If you need more help with rescue breathing, consult a voice therapist or speech-language pathologist with expertise in these respiratory retraining techniques. So, here are some final tips. Manage your triggers, such as allergies, reflux, or irritants. Practice your rescue breathing techniques faithfully 20 times a day so that they become automatic. At the first sign of cough or other VCD symptoms, begin your rescue breathing immediately. Be patient and don't give up. Believe in the techniques. They're highly effective. Focus on the fine stream exhale and don't get panicky about having difficulty inhaling. Focus on your lips or your abdomen, not your throat. If you faithfully followed our suggestions and you still have the breathing and coughing symptoms, go back to your treating medical professional. These could be the signs of other disorders. And if you really feel like you can't breathe or you're in acute distress, do not hesitate to go to the emergency room. It's always better to be safe. Hopefully, working with your doctor, your voice therapist, or speech-language pathologist, and using these rescue breathing techniques, you truly will be breathing easier. Wishing you all the best. See you next time.